Hey everybody, welcome. Today I'm Dr. Perkins, a board certified OBGYN, and today we're talking about, can I have a healthy pregnancy with PCOS? Well, we're going to dive into all of that. Firstly, we'll touch on what is PCOS. Then we'll talk about how to have a healthy pregnancy with PCOS. And we'll talk about common pregnancy complications for those with PCOS. Come on in and let's dive into this topic with me. So PCOS is polycystic ovarian syndrome, and this is a very, very common hormonal condition that affects 1 in 10 females in the reproductive age. This means somewhere between the average age of menarche, or the first period, which is somewhere around 10, 11 years old, to menopause. So we have a large group of people who are being affected by PCOS. So know that you are not alone. And if you're pregnant, congratulations. You can absolutely have a normal, healthy pregnancy with PCOS. According to the American College of Obstetricians and Gynecologists, up to 80% of women with PCOS experience infertility issues due to irregular ovulation. Despite knowing this, many women with PCOS can achieve pregnancy just normally. Now, pregnancy has occurred. Egg and sperm comes together, they've met, they've fertilized, and now you have this grown pregnancy. And your concerns are, how do I try to make sure that this pregnancy is normal and healthy, especially if you don't feel normal and healthy? I'm here to tell you, you're normal, and your condition is one that can be healthy for a growing pregnancy. So let's address some of the changes that PCOS can have on a pregnancy. I always recommend, before you even conceive, to speak with a provider, a physician in fact, but a provider will work just the same, about your PCOS and the type that you have, as well as how to plan for pregnancy. In these conversations, which we call like a consult, it is a preconception planning session. And with that, yes, you're talking about your symptoms and what you're experiencing, but you're also talking about weight management, weight goals. You're talking about how to manage your glucose and your sugars. You're talking about how to monitor and track your ovulation, how to help testing, and different things that we can do to achieve fertility and pregnancy. And so there's a lot that goes into these sessions. And so I highly encourage you to meet with your provider and have this conversation. If you're already pregnant, then wonderful. Let's talk about how PCOS may affect a growing pregnancy. According to a study published in the Journal of Diabetes Care, women with PCOS have a 3 to 4 times higher risk of developing gestational diabetes compared to women without PCOS. As we dive into common complications of pregnancy with those with PCOS, that is the first one that I'd like to mention. In general, PCOS can cause you to be in an insulin-resistant state, which in general just makes it very difficult for your body to process the sugars and glucose and carbohydrates that you eat on a daily basis. Having gestational diabetes, this is a condition that happens only in pregnancy between the weeks of 20 weeks of pregnancy, or the midpoint of pregnancy, towards the end. With that, things can become a little bit complicated, because if you develop diabetes of pregnancy, you're monitoring your sugars all day, every day. We're talking about 4 times minimum per day. You're checking your sugars. You're potentially on medication to help to control those sugars. You're worried about the growing pregnancy, which can be affected by the weight of the baby. You may be at risk of getting a cesarean section because of the weight of the baby, and so many different things that can happen specifically with gestational diabetes. But we know this risk is increased with PCOS, but it's not guaranteed. If you monitor your diet, if you are constantly moving and exercising, you're indirectly monitoring the sugars that you take in, the carbohydrates that you're eating, but you're also encouraging your muscles with activity to use up excess glucose and sugars that could be in your system. Overall, This helps to reduce the likelihood of getting gestational diabetes. PCOS may also increase the likelihood of getting hypertensive problems, such as gestational hypertension or blood pressure issues due to pregnancy or preeclampsia. Both of these can be reduced by doing several things, such as taking a baby aspirin, but don't do this unless it is actually recommended by your physician taking care of your pregnancy. But we've seen where taking a baby aspirin daily may reduce that risk overall, and this applies to those with PCOS as well. PCOS is also linked with preterm deliveries. Studies have shown that there is a higher likelihood of delivering your baby prior to 37 weeks gestation, which is the point in which we consider pregnancies to be full term. PCOS increases that risk. Now, there is one additional risk that I'd like to mention here, and that's the risk of miscarriage. Now, miscarrying may happen anywhere between conception and 20 weeks of pregnancy. I know it's very hard to think of, possibly losing a pregnancy up to the halfway point, but it can absolutely happen, and PCOS can be a risk factor for that as well. So with proper management, all of these risks can be significantly reduced. I really encourage that you monitor your diet, monitor what you're eating, monitor your sugar levels, talk to your doctors about other things that you can do to help to know if you have gestational diabetes or gestational hypertension much earlier on. It is being in tune with your body, paying attention to your symptoms, and discussing them with your provider as soon as things may change for you, as well as supporting your body with much hydration. Now, I know saying these things is so much easier than actually doing them. It can be a challenge to get started, but even during pregnancy, you can have a healthy pregnancy, and sometimes you may just need a little bit of assistance with that journey. If that may be you, I have a 7-day challenge that helps you with this. And so you can get more information about this challenge and to jumpstart the process at the link below in the description. And I have a free gift for you. If you'd like to know how your lifestyle may be impacting your hormones, go ahead and take my free quiz below at the link in the description. Thank you so much for being here. If you are currently pregnant, congratulations. Don't worry, don't stress too much about it. Just use the support that you have in your life, and that means with your providers as well as with your loved ones. Together, we're able to get to the end of the journey safely and healthily. Thank you for being here. I'm Dr. Perkins again. Take care.